Open the pod bay doors, Hal.
I'm sorry, Dave. I'm afraid I can't do that.
We assume that's the Bahamas. 544 miles per hour, 46, 56 degrees.
So my background is in chemistry, so I actually grew up in Cleveland, Ohio, and did my bachelor's degree in chemistry, master's in chemistry at Georgetown. But then I did my PhD at Albert Einstein College of Medicine, which is in the Bronx. I moved from there so I did a postdoc at Berkeley, but then moved out to Brookhaven to do a second postdoc there. And right now what I do is, my training is really in medicine, but really doing research in medicine, but I use these very fancy, big physics machines. So I spend my days trying to interpret what the physicists are doing and apply these fancy imaging tools that we have at Brookhaven to biomedical problems.
So the thing that one of the questions that is, I think, on everybody's mind is there cure? Is there progress being made in the area of Alzheimer's disease? Is there something that anyone can be doing on a daily basis? And I think I'll start that conversation by saying that I got into the field from my wife. Her family has a history of Alzheimer's disease, and it was maybe about 6 or 7 years ago that she said, you really need to work on an important problem rather than what I was working on. And so I had changed directions, and what we're trying to do is use a technique that's similar to magnetic resonance imaging, MRI, so we work with large magnetic fields, but we're looking at the atomic structures of the molecules that make up the plaques that are associated or get formed in the brains of Alzheimer's patients, and knowing the detailed structures, using that information then to make diagnostic, or to try to develop diagnostic tests, or to develop therapeutics that would perhaps dissolve plaques or inhibit the toxicity of these proteins. And so with that, I'm going to let Lisa start.
Okay, so what we'd like to do is I'll give you a little bit of an introduction to Alzheimer's disease, and then we're going to go really briefly into the research that we're working on, so that then we have enough time to see the movie too. Okay, so let me put these both up here. So probably everyone in the room is aware that Alzheimer's is a progressive neurodegenerative disease, and so it basically inhibits the ability to reason, make judgments, communicate, etc. And it's a disease that is really, it's a disease of aging, to be honest. About 1 in 10 people over the age of 65 have it, but by the time you get to be 85, 1 in 2 people have it. And so there are, but then, and what you'll see from the movie is that there are also inherited forms of the disease where patients get what's called early onset disease that can strike as early as the 30s and the 40s. But really what we know about the disease in terms of risk factors is primarily age, unless there's a genetic component to it. Now, diagnosis of the disease today is really done what we say is post-mortem. That's about the only way to really tell whether a patient had Alzheimer's disease, although psychological testing is really quite good. I'm in the field of imaging, and so we're actually interested in identifying whether there are ways to actually image what are these amyloid plaques that are forming in the brains of Alzheimer's patients. So this is what an amyloid plaque looks like in the brain tissue, but they're very small. So the amyloid plaques are on the size of, so a human hair is 80 to 100 microns in diameter, and an amyloid plaque is about that size. And so they're really, really difficult to see with techniques like MRI. Xrays can't see them because they're just they're too small. Probably one of the techniques out there that has the most promise is PET imaging, but that still has a little bit of a way to go. And unfortunately at this point, treatment, there is no cure for Alzheimer's disease at the moment, but there are a number of treatments on the market. But what actually happens in these treatments is basically it stabilizes the disease basically it helps to stimulate the healthy brain cells to work better so that the formation of these amyloid plaques that is continuing to happen as the disease progresses is basically masked. So in the early stages, the treatments tend to work because the healthy brain cells can compensate for them. But as the disease progresses, as these plaques continue to form in the brain, the treatments don't tend to work as well. So we've been talking about these plaques, and Alzheimer's disease is not alone. It falls into a family of what we can call protein misfolding diseases. So it involves all of these are neurological protein folding diseases where a naturally occurring protein in the body will misfold into an aberrant shape. Typically those are insoluble, and so what tends to happen is then those proteins will aggregate in the brain. So it happens in Parkinson's disease, Alzheimer's, ALS, Lou Gehrig's disease, and then these are all the prion diseases like mad cow disease, etc. And in each case, it's a different protein that is in the body and typically in the brain that is misfolding and aggregating, and then it causes some toxicity to the brain. In our particular case, what we're talking about today is Alzheimer's disease, so the name of the protein is amyloid beta. And incidentally, we really don't even know the true function of amyloid beta. Everybody has it, but really what it actually does in its normal process is really unknown. This is the way a plaque forms in the brain. So this is a cell, and this is the cell membrane in the purple. You have a long protein called the amyloid precursor protein, and so it spans all the way from inside the cell, across the cell membrane, and then into the outer space. And what ends up happening is there are enzymes that come along, and they cleave this protein in two different places. These are called secretases, and it leaves this little piece, which is what we actually call beta amyloid. The beta amyloid then gets released, and if it's, depending on its size, in fact, it has a propensity to aggregate. So the enzymes can cleave it at different lengths, and then the different sizes cause them to fold or misfold differently. These plaques then will form, so again, these are brain cells. These plaques will form extracellularly right here. It's thought that the reason that they're causing memory loss, et cetera, in Alzheimer's disease is, one, that there's a disruption of the communication. So you can think of that your brain is a neural network where these neurons have to talk to each other, and if something gets in the way and breaks these communications, then they can't do that. That's why loss of memory can happen. That's why the formation of new memories is tough to happen. But in addition to that, there seems to be some toxicity that's happening in the brain too. So what I mean by that is these plaques appear to be causing some sort of toxic effect that actually causes brain cells to die. So it's not just the brain cells are sitting there and they can't communicate with each other. They're actually dying in the brain. So if you were to take a look at an image of, like an MRI image of a brain of a patient with severe Alzheimer's disease, the brain actually shrinks in size because of the loss of those brain cells. And that's actually one way that they measure on a gross level the degree of severity of Alzheimer's disease. And then in genetic forms of the disease, what's really happening in these early stages is these plaques are just forming many more of them at a younger age. So it's the same pathology, the same process is happening, it's just happening in a much earlier stage of the patient's life. So it's clear that we need a better understanding of this formation of the plaques in Alzheimer's disease, and this is where both Steve's and my research come to play, but it's in a very different way. So my research is actually, we are interested, my research group is interested in the role of metal ions in neurological protein folding diseases in general. So we also study ALS, and we also study the prion diseases, but it turns out that in A-beta, so in Alzheimer's disease, you can, metals like zinc, iron, and copper will bind to this amyloid beta protein, and it will cause it to, actually what happens is that in particular, the redox active metals like copper or iron will cause the binding to amyloid precursor protein or the amyloid beta protein causes this copper to go from an oxidation state of +2 to +1. You might say, what's the big deal? But actually what then happens is that in the presence of oxygen and water, it will reoxidize that copper back to +2, and it produces something like this. This is hydrogen peroxide, which is toxic to the brain. So you may hear of things like reactive oxygen species, et cetera, which is a possible cause of toxicity from Alzheimer's disease. This is one hypothesis out there, is that these reactive oxygen species, formation of things like hydrogen peroxide, are causing this actual toxicity. So the role of metals could play a role in this process. And the reason we actually think that metals may be involved is because we did an imaging study. It's been 10 years ago now, and this is where we started this process. We use, like I mentioned in the beginning, one of these big fancy physics machines that we have at Brookhaven. This is called a synchrotron. So basically it's a very bright electron storage ring. So we spin electrons in a circular orbit, and those electrons, as they turn around their circular orbit, they give off energy, and the energy they give off is in the form of X-rays. The X-rays that we produce with this big machine are very different than you would get at the doctor because they're really small. So imagine a laser beam, but an X-ray. So the X-rays, you know, if you break your arm or your leg or you go to the dentist, it's a very big X-ray beam. The beams that we're producing are really small, and so we use those X-ray beams to image very small things. And it turns out that X-rays can image metals really well. So what you're looking at here is it's just a tissue section from an autopsy case of a severe Alzheimer's disease. The green is where the amyloid plaques are, so we just have a regular stain that can stain through where the amyloid plaque is. But then this is a copper image of the exact same area. So we use the X-ray microscope at the synchrotron to image this same piece of tissue, and you can see that where these plaques are located in many places, there are high concentrations of copper. And so we're seeing this co-localization of copper with the amyloid plaques. So the plaques have lots of copper in them, which then is where we would support the hypothesis that the binding of copper to the amyloid beta protein could be causing this redox reaction and then causing the toxicity from formation of peroxide in the brain. So this is observational at this point, and really what we're working on, myself and Steve and us and together, is to try and prove that this is true on a structural basis. So we see this in a picture from our X-ray microscope, but we want to go down to the nitty-gritty of the molecules and understand exactly what's going on. So I'm going to hand it over to Steve at this point. He's going to talk a little bit about how we're doing the actual nitty-gritty structural analysis to try and understand what we're seeing from our X-ray pictures.
So in terms of the nitty-gritty, I won't get that nitty-gritty. What I will say is that the process of forming the fibrils that form these plaques actually is a process that starts with the monomeric protein. So these are very small proteins. We're now going to the atomic level. And these small proteins will aggregate and form oligomerics, these small oligomeric species that then associate into what's called protofibrils before forming the fibrils. And the reason that this is important is that it's actually thought to be, in some cases, the small oligomeric forms that are the toxic species. That these are the things that kill nerve cells. And one idea is that in the monomeric form you have a structural change. So this is a cartoon of a monomer of the amyloid beta protein, then associating where they line up in these stripe-shaped forms to form fibrils, or they can associate into an oligomer to form a hole or a pore in the membrane. So if you have a pore in the membrane, then it lets material go both ways. It's like having a leak in your roof, and bad things happen. So we're trying to determine, really on the atomic level, the structures of these molecules in order to understand how they form, and then how potentially to make therapeutics, drugs, to prevent their formation or block their toxicity. And this is a picture of a structure of the protein, of the fibril, some of the subunits of the fibril. This would be the monomer. The monomer forms this U-shaped structure, and then this polymerizes one after the other to form the long fibril. And so structurally, if you look at this, and this is now getting down to the nitty-gritty of amino acids, these fibrils form, in the case of the fibrils involved in the amyloid plaques, form a parallel arrangement. So one comes run after the other, and you get these stripes of amino acids along the fibril. These have sort of a small side chain that's juxtaposed with ones that have a larger side chain. So along the length of a fibril, you have grooves that are forming. And why this is important is that the mature fibril is actually two of these that come together. And the large residues fit into the smaller residues, fit into the grooves like a Ziploc bag. So the reason that these molecules form plaques that are insoluble in the brain is that they zipper up in a really stable fashion, and the brain can't clear them through the vascular system. So the question is there anything that you can do? And this is where, this is actually a side view of that show that orientation a little bit better with the big side chains fitting in the grooves and these zippering up together. So one of the things that just in a test tube that we're able to clearly show is that there are some molecules, a small molecule drug, that can fit into those grooves and block the association. So this molecule right here is the yellow pigment in turmeric. Its name's curcumin. So this is in chicken curry. This molecule will bind in those grooves, and it'll actually dissolve fibrils. And it will prevent toxicity of both the oligomers and the fibrils to neurons. So that's really good news. So this is, after working on this, I went home and told my wife, more chicken curry. The problem, so the good news and the bad news, the good news is that if you look at epidemiological studies, in India there's a 4-fold lower occurrence of Alzheimer's disease in aging populations. The bad news is it's actually hard to get this molecule and other molecules across the blood-brain barrier. So although it works, and we can do this in the test tube, it's hard to show that it's actually an improvement. Nevertheless, it was something that I'm able to my wife gives us curcumin. It's safe. People eat it every night for dinner.
What did you say about the Indian population and Alzheimer's? I didn't hear.
Could you repeat the part about the Indian population and
And
Alzheimer's?
Alzheimer's.
Yeah.
Indian population?
The Indian population.
Yeah.
So looking at that the population in India, there's a lower occurrence of Alzheimer's disease. Whether that has to do, than in the U.S., whether that actually has to do with this molecule, no one knows. Yes?
If you have something like coconut oil, the MCTs do cross the blood-brain barrier. What if you mix the two together?
So we can get into that, lots of different ways of trying to combat this, and what actually drug companies are trying to do, probably in the question and answer section. So really, on the structural side, what Lisa and I and other people are doing are trying to really understand the basis for what's causing the toxicity, and then the real question then, there are two issues. One is how to get it across the blood-brain barrier, and then how to do that in a way that if you have familial mutations, you're going to have to be treated in a long-term way. This is something like kidney dialysis that you have to keep going back, or you can't cure it with one pill and then you're fixed. So there needs to be a way to do this in a cheap fashion. So going back to where Lisa and I intersect in one way is there's the fibrils that I just talked about associate in this parallel orientation. There's another associated problem with the fibrils associating with the vascular system in the brain, and these form an anti-parallel orientation. So you have one of these U's going one way and the other U going the other way. And in this case, what we're working on, and I think we're able to show, is that those are anti-parallel fibrils, is that the copper that's associated with these fibril plaques actually stabilizes this anti-parallel structure. So it binds, and then the binding is close to molecules that catalyze, or amino acids that catalyze this oxidation reaction that Lisa showed. So in summary, it's hard to do this in 15 minutes. But in summary, what I'd like to say, there's much that's known about the nitty-gritty details of Alzheimer's. A lot of people working on it, trying to cure this really awful disease. On the one hand, the idea of improving imaging to detect the different plaques and the different forms that are in the brain leads to diagnostics. Do you have Alzheimer's disease or do you not? And the idea of looking at structure, the detailed structure, hopefully will allow us to develop and design better pharmaceuticals. So very quickly, that's our introduction. We'll see the movie, and then afterwards we'd be glad to answer, to the best of our knowledge, any questions that you